So next we have agenda item number 4, report on the Austin Travis County Emergency Medical Services Injury Prevention Program.
Good afternoon, Commissioners. We have Captain Randy Chhabra and Lisa Sepulveda, our Community Injury Prevention Manager.
All right, thank you.
Thank you for coming and take it away.
Yeah.
I'd like to start with just a brief overview of what we do, and then Captain Chhabra has a short presentation that will go into more detail about our programs and services. The Austin Travis County EMS Community Relations and Injury Prevention section provides education, training, and resources to the citizens of Austin and Travis County. We also provide public safety agencies and surrounding counties with parallel programming and grant-funded resource support. Our efforts focus on reducing preventable injuries that result from predictable events. We've created targeted injury prevention programming that addresses the most common injuries that EMS responds to on a daily basis, and developed a network of partnerships and volunteers to help execute programming and create sustainable change. Our injury prevention team works collaboratively with our communities to address common injuries by applying what we know and working together to prevent unnecessary tragedies to children, families, and communities. The Austin Travis County EMS injury prevention programs include child passenger safety, Safe Baby Academy, and senior safety and fall prevention.
Yeah, thank you. And again, thank you for having us today. I'm really excited to be able to talk to you all about our outreach and injury prevention programming. When we look at our injury prevention unit, it currently consists of 2 full-time sworn staff, so it's me plus one other person, and then a manager, which is Lisa. And like Lisa described, our whole goal is to develop programs to focus on preventable causes of injury and death within our community, so areas where we can have true impact. And we do that through programs that empower families with education and also with resource distribution, depending on what the program or the topic area is. And of course, it's all data-driven, which you'll see. It's all totally community-centered and always people-focused, kind of like the rest of our department. When we look at the programs that we have, the 3 main programs, like Lisa already described, is first our Safe Baby Academy, which deals with families who are pregnant. We also have a strong child passenger safety program or car seat program that deals with families with young kids who travel in vehicles, as well as a senior home safety program that was developed toward fall prevention, but as you'll see, does a lot more than just that. So as we go through these 3 main programs, we'll start with our Safe Baby Academy, which is a 3-hour class that's was developed for people who are pregnant or for anyone who provides care for an infant. So that could be grandparents, nannies, and one of the main focuses is child passenger safety, so car seats. So motor vehicle crashes is an issue for our community, just like it is nationwide. And so we have a heavy child passenger safety component in that class. But we also get the opportunity to talk to families about things like home safety. So you're talking about poisonings, chokings, fires or scaldings for our infants, furniture hazards, TV tip-overs, falls in general. We get to talk to them about safe sleep education. So the #1 cause of preventable death within our community for age 1 month through 12 months is unsafe sleep practices. So we get to engage our community and have that discussion in this class. We also talk to them about water safety. So the #1 cause of preventable death within our community age 1 through 4 is drownings. And so we did a retrospective look back over the last 5 years of our drowning responses for children or for people under the age of 19. And we had 75 responses over that time period, and 69% of them were kids age 1 through 4. And then of course we teach infant CPR. So it's extremely important to empower our community to be able to act for that first 5 minutes of the emergency before we get there, because those first 5 minutes are crucial. And so it's not a certification class, but it's an awareness level to give them the tools to be able to respond in that first 5 minutes. So in that sense, that's our Safe Baby Academy. You can see we've only been doing it for less than 2 years. And here's see our reach, actually over 150. We had a couple classes this weekend. And so we've reached over 2,000 people in the class, the families who are identified as needing resources. What can get a free car seat from that class? We've given over almost 600 car seats, and then we've checked actually over 1,100 car seats now. So while the national average for car seat misuse is 75%, so 75% of people are misusing their car seat, at the end of our class, over 90% of the families, when we check their car seat at the end of the class, are using it correctly after we have the hands-on activities and they go through our training. And we've also been able to distribute pack and plays and baby boxes to families who we have identified as having unsafe sleep behavior. through the class, so almost 180 of those. Then we have our child passenger safety, or our car seat program. This program has trained technicians, so nationally certified child passenger safety technicians who work one-on-one with families to make sure they have the correct resource at the right time and that they're using it correctly, that their car seat's installed. And we do that in two ways. We have scheduled events monthly throughout Travis County for families where they can make appointments, but we've also developed infrastructure within Central Texas where families can go at any time to get their car seat checked or to get a free car seat. And we call those fitting stations. And all our child passenger safety programming, including through Safe Baby Academy, is funded through TxDOT, so TxDOT grants. And over the last 5 years, we've seen a significant increase in funding through that resource, which has allowed us to do a lot more for our community. And we've also developed infrastructure in the surrounding communities, so that way public safety in 8 surrounding counties that we support are able to provide for their community, as opposed to those families having to come into Travis County and us having to provide for them. And so that allows us to really focus our time and energy on families here in Travis County, as we also support public safety agencies outside of Travis County to make sure they're serving their community or have the ability to do that. Another child passenger safety program is our Focused Booster Seat program. Booster seat use is a big issue in many communities, and ours is the same. Our target audience obviously is those booster seat age kids, so kids age 5 through 12. Even though the law says a child can be in a seatbelt at age 8, they really need to be in a booster seat until they're 4'9". That's going to be around 11 or 12 years old. To do that, we partner with schools, because that's where 99% of the demographic is located. We have a strategic deployment, which I'll show you here in a second, to reach the right schools here in Travis County. And at these programs or events, we focus our education on both the child and the parent to make sure that they're both getting and understanding the right what's needed with booster seats, seatbelt use, and best practice. That strategic deployment evolves around 2 main things. So we look at crash data internally and see where people live that are involved in crashes that have young kids, as well as ticketing data from APD that for families who have been ticketed for improper restraint use or non-restraint use and that have young children, and see where they live. So here you can kind of see a heat map of the ticketing data from APD and get an idea of where those communities are. And then we go into those communities and we find elementary schools that have parent support specialists. So if a school has a parent support specialist, then you know that they are meet the Title I criteria, thus they have at least 40% of their students within that school that are considered low income. So that's the demographic we're trying to reach. So we're able to go in a targeted way and really make an impact in the areas that are really needed. This is a 9-month look at our child passenger safety program. These are our car seat events. And you can kind of see, if you were to overlay that in the previous map, purple circles are families where they live that received a car seat. That black triangles are families where they live that just got a car seat checked. And so you see the families that are receiving resources are actually the families that we've identified in those areas of high risk through the strategic deployment. Through our child passenger safety programming, we've been doing this since 2008, so we've had a lot of events. We have one of the largest programs in Texas, thanks to both organization support as well as TxDOT funding. We've done over 400 events. We've distributed over 9,000 car seats to families in need, and we've checked another almost 9,000 car seats to make sure families are using the correct seat and that it's being installed properly. And then internally, we have 45 trained, nationally certified staff members that assist with that program. And we have another about probably 50 volunteers or more, actually, in Travis County and the surrounding counties that help us execute our grant that we have through TxDOT. And then the last program that Lisa mentioned is our senior home safety program. The main focus of our senior home safety program is fall prevention. Falls are a big issue within our community, just like it is nationwide. Not only are they happening a lot, but the cost burden on our healthcare system is significant, as well as the family impact. There was a survey done back in 2014 that here in Travis County where they noted that 28% of persons over 65 stated they had fallen at least once in the last 12 months. If you apply that a percentage across the whole entire population of over 65 here in Travis County, I mean there was 24,000 people who had a fall. In that year, we did respond to 4,288 falls for people over 65, so it's definitely an issue. So when we look at fall prevention, there are 3 main areas where CDC identifies that where you can make an impact. So that's with hazard mitigation, and medication review, and exercise, making sure people stay active. For hazard mitigation for us, when we're going out and doing these home visits for these seniors, if there's a hazard that needs to be mitigated that's easy to fix, we do it. Furniture, move furniture, help them increase lighting. If we can't fix it, then we refer them to a local organization or a nonprofit that does do that. We also help them with their medication, where we get them all organized through a program called Vial of Life that also helps us if we have to respond to their house, because it puts everything in one place. And then we give them some talking points that they should take to their doctor, and if there is some concerns regarding the medications that they use. And then with exercise, there's really some basic things that we can teach people to do to keep certain muscles strong, that would help reduce the risk of having a fall. And we can also get them into, based on their insurance, into programs like Silver Sneakers or a gym membership for free, where they can be active and get that exercise as well. And on top of just focusing on those 3 items, we have a comprehensive program. So we check their smoke detectors and refer them to the fire department grant program. We provide emergency lock boxes for emergency access by EMS, fire, and police. We're also able to get them free assistive devices, so like canes, walkers, bed rails, toilet risers, things to reduce the risk of them having a fall, and then connect them with other resources within the City of Austin, like the Architectural Burial Remover program that the City of Austin has, or even through Meals on Wheels that has a home repair program, so that the bigger modifications, bathroom modifications that they might need, grab bars installed, stuff like that, that they can get done. And then on top of that, and also accessibility. So we refer them to Texas Ramp Project. They'll come out and build ramps for them if they're wheelchair bound or have issues getting in and out of their house. And then we also make sure that they have, that they're fit properly to their car. So it's not just about the house. It's about overall safety. It's through a program called Car Fit, which is for mature driving. For our home safety program, we've only been doing it for 2 years. We've done over 300 home visits, and we've referred, you can see, over 50 families to the fire department for smoke detectors, the lock boxes we just started, and we've gotten over 70 families assistive devices to make sure that they're safer in their house. 82% of the families who upon follow-up, have stated they have not had a fall since our previous contact with them. And then all this program is done on a digital platform. So we use Apricot by Social Solutions, so it connects all the programming across all 9 counties onto a single platform. Allows us to have a unified methodology with the way we collect data. We also use things like GenBook for scheduling, which allows to free up staff time and allows our community to connect with us when it's convenient for them and to set appointments with us for times that's convenient for them. So it's really a win-win on both sides. Having a digital platform also helps us get a bunch of it programmed back, so we can do things like program evaluation. So you can see here, this is just a single question that we ask. So we always ask families, how comfortable are you with installing your car seat? So you can see before a car seat event, the families, only a quarter of them stated that they were confident they can do it on their own, while 47% said that they might need some assistance. After this car seat event, 80% say now they're confident. And when we follow up with them again 12 months later, you can still see that number holds true with both the ones that are confident as well as the ones that say think they can do it, but they might need some assistance. And the 2 areas where we don't want is for families who are unable or unsure, and those are almost eliminated. We also do that with all our programs. So Safe Baby Academy, our Booster Seat program, there's all constant evaluation throughout, pre, post, follow-up to make sure that program is meeting the need for our community. And so what you can see here, so this family, this is a car accident or crash that occurred just south of Austin. So it had an adult driver and 5 children in that vehicle that was rear-ended by a semi, pushed into cross traffic, and was T-boned by another semi that took off its front end. So all 6 persons in that vehicle did go to the hospital by ambulance. 2 kids that were in the back seat. So in that top left picture, that's a 3rd row that's hanging out of the back of that vehicle. There's 2 children back there. They did get admitted and stayed in the hospital for a few days. That family was at our car seat event less than 24 hours prior to that crash. And they received free car seats from us for their children. And so we know that they were properly restrained, and those kids that were admitted were released back home within a few days and are doing completely fine and back to normal life. And so that's the kind of impact some of these prevention programs, and not some, actually all these prevention programs have. And so part of that follow-up, we know of another 9 families that have been in a crash within 12 months of being at one of our events with their child in the car seat, either that we provided or that they brought and that we taught them how to use. And none of those children were injured. When we look at the cost outcome analysis for these programs, this is one program, the Child Passenger Safety Program. The Child Safety Network did a cost outcome analysis and stated that for every car seat that you distribute is a $2,200 savings back to your community. So if we apply that across all of our programming, that we've saved our community over $20 million since we started our program back in 2008. And those is just a very brief overview of
Thank you for
our
speaking so
program.
quickly. So, commissioners, just normally I would, let you just go ahead and start asking questions, but to try and speed things up today, I'm going to go ahead and move that we recommend that council continue to fund this program and in fact expand it. I see this as extremely valuable way to spend money to prevent injuries and save money. That's my motion.
Second.
Okay, we got a second. Now, does anyone have any discussion or questions?
One quick question. The safe baby checks and in-home checks for hazards. Has the program ever asked about safe storage of firearms or anything of that nature? Is that something, since you have people in there and you're talking about hazards in the home, has that idea ever come up?
It hasn't. It's not something that we talked about internally or that we've ever really discussed. So like I said, it's pretty data-driven, and so we was focused mostly on the fall prevention or certain things like water safety or safe sleep or the child passenger safety.
If we're talking for slight expansions of the program,
Yeah.
you're in there with them at that time talking about hazards, and of course you wouldn't have to give them detailed things, even if it's just a pamphlet or something along that lines. A lot of these families are not getting that information anywhere, and in case they ever, maybe they are not even gun owners, but they might come across or have a relative visiting, something along that line. That just might be something to look into.
Yeah, no, that's a great recommendation. I appreciate
That's
that.
a great recommendation. Ms. Nunez.
Hi, sounds like a great program. Do you know what percentage of these community events are reaching Spanish-speaking populations? And also, are you trying to expand that? Because I see, especially in District 4, there's low-income working-class folks that could benefit by getting a free car seat or other safety programs.
Yeah, so I don't know the exact percentage. We could pull that out of our database and tell you how many what's the percentage of the primary language of being Spanish. We do offer Safe Baby Academy in Spanish, so we do partner with the Community Care Clinic as well as the Gabriel Life Center through the Catholic Archdiocese to focus directly at that demographic of Spanish speaking. I don't know what the percentage is. Okay. Yeah, thanks.
If you want to email that information to me, and I'll make sure everyone gets it.
Yeah.
Any other discussion before we vote? So the motion is that council expand this program and bring it to more families and hopefully prevent more injuries. All in favor? All opposed? Okay, thank you. Thank you.
Thank you very much.